It's a great day for us here in East Tennessee and Knoxville in particular. We're here meeting with associates and physicians and the leadership team at the 7 facilities in the region, and so we're very excited about our opportunity to partner with these folks. And we spent a lot of time this morning meeting with the leadership team, meeting with associates and rounding during the hospitals this afternoon, and with the medical staff a little later today. Look forward to this being our first opportunity to answer questions for you guys and hopefully give you a little insight as to who we are or what we know our direction is at this point in the marketplace. And with that, I'm not going to have a lot of preamble statements necessarily. I think it would be best just to answer questions with you, if that's fine. And if we feel the need to segue back into something on more of a global platform, I'll jump back in and do that.
Well, I do have one. I know since this just happened Friday, the big announcement, you may not have had a chance to come up with a new name yet.
Right.
Have you?
No. We have been in the due diligence process for about 6 to 8 weeks now, and that's largely a process whereby we're looking at the opportunity here, making sure it fits with our structure, fits with any kind of concerns that might be there. We did not find any. And likewise, Catholic Health Partners based in Ohio are doing the same thing. What we've announced on Friday and what we are here talking about today is the signing of the definitive agreement on Friday. Now, we have until anticipated October 1st to close on the transaction, so the time spent between now and then, we'll be working through that process. We have engaged folks, both locally, focus groups, and folks nationally to help us on the naming process. There's a lot of things to balance. There's legacy to balance. There's the Baptist system, there's legacy of the Catholic systems here, and then there's sort of a renaissance period here as well too, that you sort of start fresh. And we're trying to find the right balance with that. So in all candor, we do not have namings for a system, and frankly some of the hospitals here still have Mercy, and with due respect to the Mercy Health System, they retain the right to that name. So Mercy will have to stay with the Catholic Health Partners in Ohio.
Thank you.
Mm-hmm.
I know that you said that the physicians and medical staff won't be changing, but is there going to be any change to the healthcare providers or the insurance companies that you accept?
No, we in a sense, we accept the providers that you would see at this hospital are the ones that we deal with on a national level or on a local level in the 3 other hospitals that we have in the state of Tennessee that we operate currently. And we welcome the opportunity to transfer and work with those provider health plans. We're in the process through the due diligence of working through those being assigned to and transferred to us. So we would welcome the opportunity to work with all those payers.
I know patients watching at home, they just want to know the bottom line, and you did answer a little bit about what may not and may change for them.
Sure.
But what would you tell them?
About what?
Just about what they can expect.
Well, I think with health management, you see that we will provide from a Naples-based organization the resources here, and our tagline and motto is that we enable America's best local health care. In this case, we would say we enable East Tennessee's best local health care. And I think what you would expect to see from us is that we're going to assist in any way it's possible to the leadership teams here in East Tennessee in the respective hospitals and in the systems, and that we would know when to back off from that and know when to let the local folks lead. And that's what the extensive part on the local leadership, and that's very much a core of what we do. Local leadership will be based here in Knoxville and East Tennessee to run the system. Other folks, such as myself and my colleagues, would offer perspective from Naples on that. What I think the patients can expect is more of the same in this sense, and that is compassionate, focused care on the well-being of patients, on optimal outcomes, and on exemplary patient service. And that's measured and looked at in many ways, but it's the patient experience that we believe is the important piece, and that we would continue. We believe the Mercy system here has done a good job in forging ahead. Some of their scores through Press Ganey and other external measures are very, very good when compared to peers in the country. And so we want to further that with some systems we have in place. So a focus on patient care. And as far as what they can expect from us from a patient standpoint, strategically, an enhancement of services that exist today, and definitely not a takeaway of services that exist today.
Healthcare is obviously such a serious issue, but I got to tell you, I've gotten a few calls at the station about the change and what to expect, but several of them have been about Peyton Manning.
Yes.
And his role here.
Absolutely. Well, we have had the good fortune to meet with Mr. Manning, and we have made it clear that we would love to continue the relationship with him, and we feel like we're in a good level of conversation with him. I'm not at liberty to speak for him, obviously, nor would I choose to at this point, but I think it's a natural fit for us on a go-forward basis, and we believe at this juncture that we will be able to do that, but that's part of between now and October 1st.
Health management has a long history of charitable projects and works. How do you intend to continue that as you use it to this role?
Well, I think the first thing that you should know is at its core basis, we will maintain the existing charity care policy of the hospital here. So that's not going to change. And for anybody who might think that that was in any way going to be more or less than it is today, we adopt the existing policy that's in place. So you're not going to have a charitable care change in terms of the provision of care here and the ability to pay and how we work through that with our patients. As far as being a good corporate citizen, we will continue to involve ourselves like we do in our other markets across the United States, and that is we're going to be a good corporate citizen. We're going to continue to work through charitable care organizations here as partners. We're going to seek partnership with them. If they already exist, we're going to further those, and we'll seek out new relationships where it makes sense. The other piece I think that can't be lost in the equation is we will be a formidable revenue source for the local economy. As you saw in the press release, we will have about $4.5 million in annual tax revenues from real estate property and sales tax generated to the marketplace. And while that's not charity in a sense, we hope to have a voice in how that gets used and how that gets used for betterment of not only the community but healthcare as well.
Is that number based on all 7?
It is. Yes, ma'am. It is.
The Vatican, between now and October 1st, still needs to approve this deal. Do you have any reason to believe that they wouldn't?
Well, I'm going to obviously defer to the folks at local diocese, and I'm going to refer to the sisters, the sisters that will continue on with us here as we go forward. And the process for approval is that the sisters would need to make recommendation for us to further that relationship. The bishop would need to make recommendation to that, and that's a formal process that's filed with the Vatican. We have feedback that says that that has all been approved, is packaged, and is en route or is ready to be sent to the Vatican. I can't imagine that there would be anything that would get in the way of that process. I believe, and I can't speak for Mercy and Catholic Health Partners, but in the end I believe our values, our strong Judeo-Christian based values as an organization personally for our organization and those here fit perfectly, and part of that cultural integration is what they saw as value in this merger, and I think that will be communicated with the Vatican as well.
Is this the first Catholic system that
No. Health management has a fairly long history of integrating Catholic hospitals, and frankly with various orders throughout the states. So it's not with one organization in particular. They're with many, and if my numbers are right, and forgive me if they're wrong, but I think we have relationships with approximately 7 former Catholic hospitals or health systems in and around the United States. And frankly, the part of the due diligence process and the selection process here is we availed anyone at those facilities or in the process that made the decisions from those particular orders and those particular hospitals to be reference points for the leadership here.
Can you talk about what makes Mercy an attractive fit for health management, and can you talk about how the Mercy system compares to other systems within health management?
Sure. In terms of being a fit, we occupy the space in healthcare that we call non-urban, and it means we're not in metropolitan cities such as Chicago, New York, or other major metro cities, but we have a comfort zone both in our existing operations and in our go-forward opportunities in the non-urban settings, which are either on the fringe of a major metropolitan city or in and of itself is a reasonable sized city, 600,000 population base. And we believe that we are the pure space player in that arena. Really, there are other rural providers or metropolitan providers. We believe we're the unique healthcare company out there that plays in that particular space. So in that sense, Mercy is a perfect partnership for us, and the facilities here are perfect. As far as why else does it make sense, we have experience with all levels of hospitals in our organization, from 500-bed tertiary facilities, which you would see compared to the existing Mercy, Maine or St. Mary's campus here, to singular sole community provider hospitals that might look more like hospitals in Newport or La Follette or in Jefferson City. So all the hospitals to us look like hospitals that are in our system. We feel very comfortable with that. The other reason we think it's a good fit for us is because we have a track record of taking hospitals, integrating them from a systems standpoint. We believe there's ample opportunity. To your second question, we have hospitals in the Jackson, Mississippi market that are concentrated a lot like this market, and we have experience for many years there. We have 22 hospitals in the state of Florida, and we have concentrations in markets throughout the state of Florida, and definitely on a statewide presence. We're accustomed, particularly in the state of Florida, to deal with government or regulatory or any other opportunity strategically as well too. So,
what about competition?
I am a division president of a select region of hospitals, but as a general rule, a vast majority of our hospitals have competition, and the eastern part of the United States is where I tend to concentrate my hospital leadership and assistance. And in virtually every one, not all, but virtually every one of those markets, we have a formidable competitor, and in many times a much more sizable competitor than our particular hospital is. So we honestly welcome competition. We think it makes us better. We think we make them better. And in the end, I think it's about delivering, as I said earlier, the best care and the best service. That's ultimately what wins.
Going along with what Lori asked before about just the bottom line, what are some of the changes, the biggest changes that the patients can expect, if any?
I think advancement of service lines, continuation of the things that work well, taking them to the next level, things that are not offered here today in the way of services, particular services that they would be on a go-forward basis, and I think it's the opportunity to afford citizens in these communities that same level of health care they could get at any other facility, and hopefully better on the outcome side and on the service side than they can get. They're not going to see, if I can answer the negative side of that equation too, they're not going to see a diminution of those services. We're not taking things away. So it's more, you can expect to see what you have now and even more of, and hopefully better than and more expansive.